All right, hello everyone. We're here today to present on our poster on erectile dysfunction in a national sample of male US veterans. So we know this is a significant issue. Erectile dysfunction is one of the most common sexual dysfunctions in men. It affects more than 18% of men over the age of 20. And in particular, there are a significant amount of other factors and disorders that can increase the risk of erectile dysfunction, including mental health concerns like PTSD, depression, and anxiety, as well as physical health disorders and concerns like alcohol misuse, smoking cigarettes, cancer, and sleep apnea, and some other factors. So things like education level and general stress level can increase your risk. And among US veterans, we know that the study of erectile dysfunction and its co-occurrence with other physical and mental health disorders remains very understudied. So really the goals for our project here were to identify both psychopathology and physical health concerns that are comorbid with ED that may help inform screening by health professionals going forward.
So our sample consisted of 921 US male veterans. They were asked questions about their demographics, their military characteristics, and their mental and physical health. Of the 921 US male veterans, 131 of them reported a past diagnosis of ED, which is about 14% of the sample. Using weighted data, we found that veterans with ED were more likely to have served in the Vietnam War, combat, be unemployed, and have less than 4 years of service in the military. These mentioned items were our covariates for the study. After adjusting for the covariates, we found that a significant proportion of the sample had both ED and arthritis, respiratory issues, cancer, chronic pain, diabetes, heart disease, high cholesterol, high blood pressure, obesity, or sleep disorders. So after adjusting for the mentioned covariates and the number of physical health conditions that were just mentioned, ED was associated with depression, suicidal ideation, and at-risk problem gambling. To conclude, veterans with ED were 2 times more likely to report a diagnosis of arthritis, respiratory illness, cancer, chronic pain, diabetes, heart disease, high cholesterol, high blood pressure, and obesity, and 3 times more likely to be diagnosed with a sleep disorder. Veterans with ED were 2 times more likely to report suicidal ideation and at-risk problem gambling, and 3 times more likely to report depression. In order to determine which mental health condition resulted in the greatest likelihood of ED, we conducted a logistic hierarchical regression analysis that indicated that veterans with ED were 3.4 times more likely to have ED than veterans without ED. This has a significant clinical implication as one diagnosis should alert medical providers to increased likelihood of the alternative diagnosis. So some limitations for the study are that data on race and socioeconomic status was not collected, and future research should determine the direction of the relationship between ED, psychopathology, and the mentioned physical health issues. That is everything. And